Okay, antisepsis, reducing microbial density on living tissue. Disinfection, reducing microbial density on inert materials. Okay, disinfectants, high-level disinfectants, may be used by somebody other than you to sterilize equipment. But you are not authorized to sterilize anything. That is not within your scope of practice. Okay? So you can know that in some cases in the medical community or in the scientific community, high-level disinfectants may be used to sterilize equipment. But this does not apply in your practice. Your sterile equipment comes to you pre-packaged to preserve its sterility. Okay? But you don't get to sterilize needles. All right, asepsis is something that doesn't really apply to us. If you notice this image of a surgeon all decked out in surgical garb, with all of the, IVs and that sort of thing. Asepsis is important in the surgical world where you're going to open somebody up to the air, and everything in that environment needs to be as clean as possible. Okay, so surgical procedures, some laboratory procedures, but in acupuncture we're not doing surgery. So asepsis, as in absence of any pathogens from the entire environment, is not practical in our situation, and it's not required because we are not cutting into people and opening them up to the environment around them. Okay. A clean field, we're going to talk a lot about. It's prepared for our equipment, and it's arranged to preserve the sterility of needles and the cleanliness of other tools. Okay? We're going to talk more about the clean field, but basically it's three-dimensional. It includes your hands, it includes the patient, it includes the field, and it includes the airspace above the field. Okay, so anything that comes in contact with my hands may contaminate them. Anything that comes in contact with the skin of the patient may contaminate it. And anything that comes in contact with the field or violates the airspace over the field may contaminate it. It's a really important concept we'll work on today. Clean technique, which is what we're moving right into, prevents contamination. Okay? It keeps your patients, yourself, your staff, your family from getting further pathogens. Okay? So clean technique preserves cleanliness. It does not ensure sterility because your clean technique involves clean instruments, a clean field. But those don't start out sterile. We just keep them clean. The only thing that's sterile is those prepackaged tools. Okay? And clean technique uses antisepsis on your hands, on the patient's skin, etc., which may be hand washing, or it may be alcohol swab or other things. We use sterile needles, and then we use standard precautions. Now, interestingly enough, universal precautions really hasn't been a term in the medical community for about 8 years now. So we're dropping it too in our next course, but it's still mentioned in this document as being the descriptor for the precautions that we take. Universal precautions in a surgical suite is way up here. Gowns, gloves, masks, goggles, etc. For us, universal precautions means knowing when to wear gloves, knowing when to wash your hands, knowing when to wear protective clothing, protect your eyes, or if you're dealing with tuberculosis, protect your intake through breathing, etc. Okay? So universal precautions for us is not the same as full universal precautions. And I used to I used to suffer from having colleagues who would say to medical doctors, oh, I use universal precautions. And the doctors would just have a good laugh because they would know that that wasn't appropriate or necessary for us. What we're using is the standard precautions for our field. Okay. Contamination is anything that disrupts the cleanliness or the sterility of your tools and instruments. Okay? If something becomes contaminated, it is no longer useful. All right? So, I've just washed my hands, okay? And I'm busy getting ready to treat the patient. And then I realize, oh, I'm going to be leaning over this patient and my hair is going to fall in my eyes, so let me put my hair back. Are my hands still clean? Good. No, they are not. Okay? So I've laid out a clean field. I washed my hands, I laid out a clean field, I set up my table. I'm ready to treat. Okay? And then I turn to the patient and they have helpfully pulled their sleeves back down to cover the areas that I've already cleaned. Okay? I'm going to roll their sleeves back up. What is contaminated now? My hands and the sites that I had previously cleaned that have had the clothing pulled over them again, right? Okay, so I need to wash my hands. I need to re-swab if those areas were in need of cleaning. Okay, so here's my clean field. I've got it all set up. And I am going to treat, and I realize, oh yeah, I just hate wearing my glasses. So I put them on the clean field while I go treat the patient. Okay? Is that clean field still useful for its intended purpose? Good. Okay? It has been contaminated. If I put my pen on the clean field? No. Okay? So anything that is not clean or that can be a vector of other disease or other contamination, invalidates whatever it is that was clean or sterile. So I take the needle out of the tube, I start to put it in the patient, and I realize, oh, I chose such a long needle and it's so thin, I'm having difficulty getting it in. So do I place my fingers on the shaft of that needle? Why not? They're clean.
It's sterile. The needle is sterile.
Thank you. The needle shaft has to remain sterile, right? So getting that needle shaft into that patient, I've got to make sure that it doesn't come in contact with anything that is merely clean, because that's not good enough, okay? So I'm going to get a sterile gauze from my kit with my clean hand to stabilize that needle. Is that okay? As long as the sterile gauze has contacted nothing prior to contacting the needle, it's fine. Okay? Does that make sense? So anything that's clean has to stay clean. Anything that's sterile has to stay sterile. Anything that contaminates them means that I can no longer use them, right? Right?
Right.
Right? Still with me? All right. So disinfectants we've talked about use on office surfaces, and they reduce risk. They don't 100% prevent it, but they reduce it. Okay? When we look at cleaning the skin, we have multiple options. Okay? The first option is the skin clean? So a patient may come in, and let's say you've got a little sink right in your treatment room. And the patient may come in and go, you know, I just had this soda and my hands are sticky. May I wash them? Okay? So you watch, and they wash their hands very well. They lather on both sides of their hands. They rinse well. They get a paper towel from your dispenser. They dry their hands carefully, and they don't touch anything else. Can you place a needle in that hand once it's dry without needing additional cleaning?
No.
What do you think? How many hands say yes, that you can place a needle in the now dried hand of somebody who has just washed their hands well? How many say yes? Oh, 3 brave people. How many say no? Oh, come on, you guys are on the fence. Okay, some of you have come out strongly against. Some of you are still sitting there going, I'm not going to answer. All right, well, those 3 brave people are right. In contemporary medical understandings, washing is one of the best ways to remove pathogens. So if your patient has just washed skin, there's no need to clean it again, unless it obviously looks dirty. You know, unless it's a 5-year-old who had really muddy hands and washes them and they're still muddy, okay? So if someone has just washed skin, it's not necessary to use an antiseptic on it, okay? But if you're going to use an antiseptic, then using isopropyl alcohol, 70%, is a good way to get pathogens swept away from the area. It doesn't kill 100% of them. Now, some of you are like, well, if 70% is good, then 100% is better. Well, no, because 100% alcohol or 90% alcohol or 86% alcohol evaporates before it can do anything. Okay, 70% hangs around long enough to kill a few guys. Okay, so be alert to that. All right. For cleaning in the office setting, bleach is a very effective cleanser as long as you use it at the right concentration and as long as it's fresh. You can mix up a new solution of bleach on Monday and it'll be effective on Monday. But if you come into the office on Wednesday and use that same solution, it will not be effective. It will have lost its effectiveness as a cleaner. Okay? So when you make up these solutions, you're going to follow the instructions of whoever manufactured the product on how to make up the dilute solution of it. But know that in most cases, you're going to need to make a new solution on a daily basis in order for it to be useful. So for routine cleaning, that is to say just cleaning your treatment table, cleaning surfaces in your office, a 1 to 100 solution of bleach, that is 1 part of bleach, 100 parts of water, is going to be a good cleaning solution. Okay? If you have a big spill, like maybe you share an office with a medical doctor, or there's a laboratory right next door, so patients come in with urine samples, or the lab tech comes in and draws a vial of blood in your office. If that shatters and spills, then you're going to go to a higher concentration of 1 to 10 in order to really clean that up and clear it up effectively. Okay? Now, what we need to know about this is isopropanol, even though it's a good cleaner for the skin, injures the skin over the long term. So do you want to get in the habit of using a cotton swab, an alcohol swab, to clean your skin between needling? No, because what you're doing is destroying your skin. Okay? It's a defatting agent, and so using alcohol-based hand cleansers, alcohol swabs, that sort of thing to clean your skin, eventually it will become thin, it'll become depleted in the natural communities that are supposed to protect it. It will lose the supportive fats that help it to be resilient. And in some cases, they've documented individuals using alcohol hand sanitizers repeatedly over a long period of time lose elasticity and mobility in their hands. Okay? So hand washing is by far your best solution. And then if you need to use these cleaners, use them knowing what you're doing. Okay? So for my patients, if they come in, they often will tell me, I took a shower, but I walked here in sandals. Okay? That's our clue that I know that most of their body has been cleaned recently, and I can choose which points may have been compromised that need a little alcohol swab touch-up. Okay? But for those purposes, we can use isopropanol on the skin. We can use iodophores, which is iodine also. Your patients may or may not like the color of iodine on their skin, and some individuals are allergic to it. So you don't want to just swap out and use iodine for everybody instead of alcohol. Okay? But I want to show you just a little visual of what happens when we clean the skin. Okay? So that visual would be, we've got a community of bacteria and pathogens accumulated on the skin, and we want to make room to needle. Okay? Now we know from what I just said that we're not going to wipe out 100% of those pathogens, right? But what we're going to do, and let's say this is one of the pathogens, what we're going to do as we take our alcohol swab and move it through the community is we're going to move the pathogens out of the area we want to needle. We'll kill some, we'll move others. Okay? So if you're going to swab an area, you're not going to swab it because you're only creating soup. You're creating pathogen soup, okay, rather than actually clearing the area. So you want to move right across. It's okay, Ash. I'm going to come right back. I'm sorry. You're just going to move across the area, clearing things as you can, okay? Or if you've been trained to do this in your clinic, you're going to move as much as you can out of the way by creating a single swipe across around the area and out. Okay? And then where do you needle? At ground zero, where the most push went to remove the pathogens from the area. Okay? Any questions about that? So today, when I see you demonstrating your needling skills and your cleaning skills, you're going to give us one clear swipe, right? Or a C swipe if you've been trained to do that. That gives us a really clear path that we know is relatively free of pathogens for needling purposes. Okay. All right. Sterilization, just like pregnancy, it is either sterile or not. You are either pregnant or not. There's no halfway. Okay? So it's a rigid term. We only use it in reference to needles, 7-star implements. What do we use for bleeding? Lancets. Thank you. Sorry, just fled my mind. Okay, those come to us prepackaged, sterile. As long as they are in the package, they remain sterile until the packaging is expired and loses its ability to protect sterility. Okay? So there's no such thing as partial sterility. If you open a package of needles, it is rapidly losing its sterility as it sits on the counter, as air moves through, as the packaging degrades, etc. So there's no such thing as maintaining sterility for an instrument that was in a sterile package and then remains in an open package for some period of time. Okay, which means use your needles judiciously. Open them when you're going to use them. Okay. Anything that penetrates the skin must be sterile. This is another reason you can't go in and retrieve a needle when a handle has broken off and the needle has penetrated below the level of the skin. You can't go digging into the skin and retrieve that needle because you do not have A, degree in surgery and a license to perform surgery, or B, the sterile tools and sterile environment to do that. Okay? So anything that penetrates the skin or that touches instruments that penetrate the skin must be sterile. Right? All right. let's have the lights up so people can see their books, and I'm going to just take a little break from my voice in the next 5 minutes. I would ask you to respect your classmates by not talking right now, because some individuals are really going to want to go back to the highlighting in their books or look forward to the material we need to cover in the next 45 minutes. I want to make one comment about, I understand that there have been a lot of cell phones and tablets popping up out there, and I want to make one quick statement here that's very important. I understand that some of you may have needed to look up a word here and there or something like that, but I hear from the administrators that there have been multiple cell phones and multiple tablets just popping out of pockets on a regular basis. And basically what I've asked them to do is just note who is doing that. And when we get to the exam process, I'll ask you to leave your phone and tablets with them until you've completed the day, unless there's some urgent reason that you need to have it with you, okay? I understand how automatic it is for us to reach for our phones. I did that just at the break. I was like, oh, what does my phone say? But we cannot be doing that through the rest of the day. So those of you who've not been able to put down your phone or tablets through the course of the morning, I'll just ask you as soon as we start the exam process just to leave your phones or tablets with our administrators, and they may do you the favor of coming to you and offering to accept them from you. So please cooperate with them at that point in time, and then we'll all be comfortable that you won't accidentally be checking your phone when you shouldn't be, or some others will be comfortable that you're not perhaps compromising the exam. Okay? All right, can we have the lights down again for this last bit of the PowerPoint? Except maybe not down quite so much, because I will read faster and move faster if I can see a little bit clearer. So, is that okay? Can you guys see the screen all right? Okay. All right, so we'll plow right ahead. What? It doesn't change. Okay. All right. All right. Thank you. Okay. And by the way, if you had your phone out or on in the last few minutes, please turn it off, put it away so that it doesn't interfere with the class. All right, so back to the CDC and OSHA and how they came into this process. The CDC is the one that developed the standard precautions that we use, such as, how do we know when bloodborne pathogens may be present and what's the appropriate way to kind of come against those and protect ourselves from them, whether it's gloves, protective clothing, eyewear, or whatever. OSHA is the one that took those recommendations and said, okay, this is a standard. Okay, so if someone from the health department comes into your office or the fire department, as happens in my community, I've occasionally had the pleasure of coming out into my waiting room and finding a very handsome fireman standing in my waiting room. And he wasn't there to see me. He was there to look at the fire safety aspects of my office and the general safety aspects of my office. And on occasion, the health department will do the same thing. So what OSHA did is set up standards so that any inspector, particularly OSHA, or any judge or legal entity can know whether you are meeting the standards for effective care or for effective protection. So OSHA took those standards about gloves, about hand care, and that sort of thing, I'm pulling a paper towel down with this motion here. They took those standards and put them into compact form. So when you look at an office space, for example, you will not find office space that is coded medical that has no available restrooms and no available hand washing, right? Because OSHA says, well, if this practitioner is going to wash their hands many times a day, then when we set up environments for healthcare workers to work, hand washing has to be easily accessible. Okay, so OSHA has developed You know, all of the recommendations for things like having a paper towel dispenser rather than having paper towels sitting on a counter where it is open to the air, open to droplets, open to other contamination, right? So that's the way the two organizations have worked on our behalf to develop the standards that we use. Okay. Moving into C&T, the 4 basic principles of clean needle technique are always washing your hands between patients and before and after needling. Really important. So wash my hands between patients so I'm not taking pathogens from patient A to patient B. Then I greet patient B, shake their hand, greet them, take their pulse, look at their tongue, inspect their ear or their throat or whatever I need to do. And then, before I can begin needling, I wash my hands again because they've been contaminated, right? Right?
Mm-hmm.
Right.
Right? Okay, you guys have already fallen asleep after lunch. Okay, so we're always going to wash our hands before and after needling and between patients. Okay, always using sterile, single-use needles and other instruments that break the skin, such as 7-star lancets. Always establishing a clean field. Always immediately isolating used needles and other sharps. Okay, so we've got 4 alwayses. Just pick one, associate it with a finger, memorize it so that you can recite it backwards and forwards. These are critical standards for your practice. Okay, so keep on top of them. Hand washing, as we've talked about, is the single most important procedure for preventing infections in healthcare. Hospitals have found over and over and over again that no matter how many cleaning crews they employ, no matter how cold they keep it, no matter how much antiseptic they make available, if the doctors don't wash their hands, then there's less barrier to infection. Okay? The doctors themselves communicate a lot of infection if they don't wash their hands. Okay? So this is critical. And as we talked about earlier, hand washing, not just hand sanitizing. Okay? And why would we not just do hand sanitizing? Okay, damages the skin. Why else?
Doesn't rinse away the soilage of.
Okay. As we talked about, good insight. If we talked about if you're using alcohol, you're just pushing that population around. So you're going to have to use the right amount of hand sanitizer and vigorously rub your hands until it's dry so that you're dislodging as much as you can. How many of you know people that actually use hand sanitizer that way? Nobody, right? Most people who use hand sanitizer kind of do the prophylactic, kind of put a drop on and then go about their business. Okay, that is not an effective use of it. And if you use it that way at every encounter, then you're going to damage your skin, right? So hand washing, hand washing. Okay, superior to hand sanitizers. Not less than 60% alcohol in the hand sanitizer, so you see that alcohol content is still high. All right, with hand washing, somebody know what page we're on? 29. Okay, with hand washing, we know that there's 2 types of infectious agents. The transient type that you get in the course of the day. So you go through your business, you've got transient pathogens on your hand, you wash them and get rid of them. Okay? Then there's the resident pathogens that are lodged deeper. They're not removed by standard soap or water or even antiseptic cleansing. Okay? Those resident pathogens, let's say you have a fungal infection. That is a resident pathogen. It is not going to be dislodged by cleaning. So you're going to want to wear a glove in that case to protect against transmitting that pathogen. Okay? When we wash our hands, We want, of course, to save ourselves as much time and energy as possible. So, if I'm going to put my glasses on as I go through the clinical day, I want to put them on before I wash my hands, okay? If I'm going to lean over a patient in the course of needling, I'm not going to want my sleeve to be dragging across that patient. So I'm either going to secure my sleeve up and out, or I'm going to take off my jacket so I don't interfere with the clean field that I'm establishing, all right? So any jewelry that I have on that might interfere with appropriate hand washing, I'm going to remove, etc. So you're going to use liquid soap, not bar soap. Bar soap creates a little swimming pool that pathogens love, okay? Under the bar, there'll be that drippage of water and soap that creates a great little pool for more bacteria to enjoy having a lovely time, all right? So liquid soap dispensed from a pump or from a wall installation that you put on every part of your hand, making sure every part of your hand and upper wrist are covered, making sure that you get it between your fingers, under the nails, front and back, okay? Then you're going to scrub for 10 to 15 seconds. The state of California says you're going to use a brush to do that, and you're going to scrub under your nails, around your nail beds, the whole surface of the back and front of your hand for 10 to 15 seconds. A really effective way to time that, if you don't want to punch a timer every time you do it, is approximately how long it takes to sing Happy Birthday twice. Okay, so happy birthday to you, happy birthday to you, happy birthday, happy birthday, happy birthday to you, twice. Okay, so that renders most of the pathogens dislodged. They've come in contact with the soap, with the water, with the brushing action. And then you're going to lower your hands so that your hands are below your elbows. Rinse until all soap and debris are rinsed until there's clean running water coming off of your fingertips. Then you're going to take a dry paper towel from a dispenser and dry your hands, okay? You're going to take another dry paper towel if you have to turn off the faucet, okay? If you have to open a door, or if you have to come into contact with anything else before you are going to needle that patient, you want a dry paper towel between you and the environment until you're ready to needle that patient, okay? So if your hands, in the field setting, in your office setting, of course, you're going to wash your hands regularly and often. In a field setting, if your hands are visibly dirty, you're going to use soap and water, which may mean taking a break. If you're working in a setting where there's 100 people lined up to get acupuncture and you notice that your hands have become soiled, it may mean they have to wait a minute while you walk over to the sink, wash your hands, and then make your way back to your site, okay? But if your hands are not soiled in a mass care setting, where if your hands are not soiled, you can use a hand sanitizer appropriately between patients and before and after needling, and that is acceptable in a field setting, okay? So before and after contact with patients, before and after contact with the patient's intact skin, okay? So I'm going to wash my hands. May I use you as a sample patient, sir? I'm going to wash my hands. I'm going to say, hi, how are you?
Great.
Great. I notice as I'm observing silently, I'm not saying this to the individual, I notice no lesions, no sores, no cuts. So I'm like, yeah, the skin's intact, that's good. Well, I'm really glad to hear how things are going for you. How's the tightness in your hand? Has that been relieved lately? Is it
Relief from last treatment, but I need another one.
okay? So are you still getting soreness in this area?
Yes.
Okay. And how about your wrist?
No.
Okay. So I've been contacting his hand. I've been examining it. It's intact. It's clean. That's fine. But when I take his pulses and then say, oh yeah, how's your headache? Does it still hurt right here? You know, then I'm still within my appropriate care. My hands are clean. I'm contacting intact skin. But then I'm like, okay, go get on the table. I'm going to wash my hands, right? And I wash my hands. I clean the skin that I want to needle, if it's not already clean. Okay. Next, I'm like, I'd like to put a needle right here. This patient is already consented. He's experienced. I don't have to get his consent. But I want to put a needle right there. I've swabbed the area. I've allowed the swab to dry, or the area to dry. And I have clean fingers. Is it okay for me to palpate that area that I've cleaned?
Yes.
Yes. Clean, clean. Clean works, okay? If I palpate an area I haven't cleaned, that's not okay, because my fingers then have become contaminated and I have to go wash them again, okay? But clean, clean is fine. Now, my hands are still clean. Can I pick up a needle and place it in that spot? Yes, my hands are still clean, okay? So I've cleaned my hands, I've cleaned this area, I've palpated to make sure where the structures are that I want to needle between. I've placed a needle. Do I need to wash my hands?
Nope. No.
No, I don't. Correct? Okay, now, I go to the next treatment table, and the next individual is sitting here. Do I need to wash my hands?
Yes.
But they're still clean.
Cross-contamination.
Ah, all right. They're clean for that person, but not for this person, right? So they're not clean until I wash my hands for this individual. So that even though I had cleaned this individual, remember we're not getting 100% clean, right? So between this person and this one, I'm going to wash my hands to make sure I'm not bringing something to them that was not resident with them before. Okay? So, show of hands. How many people say it's okay when you have clean hands to palpate a newly cleaned point on the patient that you're working with? Come on, don't be shy. I want 100% of your hands in the air. Clean hand, clean point. It's okay to contact it. Right? Okay, one more time. People who think it's okay with a clean hand to contact a clean point, raise your hands. That should be 100%. All right, don't be shy. Okay. Thank you. Point made. All right. But I need to wash my hands between patients, yes?
Yes.
And now that I've come back to check on an acupoint for this patient, and I've been going through my book, when I come back to that patient, am I ready to resume needling?
No.
Good. Okay, so my hands have not kept clean. Okay, so before and after any contact with the patient, before and after fluids or dealing with any body fluids for the patient, or dealing with any dressings, you're going to wash your hands. Okay? So I might look at a dressing, I'm giving you a dressing on your ankle. You can give it back later. But let's say I look at a dressing on his ankle. Before I go to needle anywhere else on his body, I've got to wash my hands. Why?
Because of potential contamination.
Okay, because in this case, the patient's body is part of the environment in which they might be receiving contamination. If I look at a dressing on a wound and then needle a different part of the body, I might take the pathogen from that area to a different part of that individual's body, right? So I'm going to wash my hands, okay? Let's say I've decided I'm going to wear gloves to examine an infant's rash. Okay, so I put my gloves on, I examine the infant, I look at their rash, I palpate it, then I take the gloves off. Are my hands still clean? Nope, they are not. Okay, Putting the gloves on is a process which contaminates the hands, even though the gloves protect the hands. Okay, so taking them off, the gloves are contaminated, and taking them off, also, the hands are still contaminated. They need to be washed. Okay, before or after eating. Now this is kind of a gross example, but it makes the point. You've seen 12 patients in the morning, including a couple cases of foot fungus, a couple of cases of baby eczema, including an elder person's persistent viral rash. Okay, so you go to your desk and you pull out your lunch and you sit down to eat your lunch, and then you go, did I wash my hands? Do I really want to eat anything that I came in contact with this morning? So you want to make a point to wash your hands at all of these opportunities and before and after eating. Your patient doesn't need your peanut butter and jelly on their wrist. Okay? Also, after you use the restroom, of course. Okay? All right. So, we've covered this, but underlining it's critical. Anything that penetrates the skin has to be sterile. All right? One needle, one point. You're going to keep that needle shaft sterile. How will you keep it sterile if you need assistance putting it in? Using the sterile gauze to support it. Okay? Do you take the sterile gauze out of its packaging and place it on your clean field? Why not? Okay, the clean field is merely clean. Okay, anytime you take anything out of its sterile packaging, it loses its sterility if it comes in contact with anything before contact with that patient. Okay. And a key point, acupuncture needles are by definition filiform. That is to say, they are solid. They do not have a lumen in them or the hole in them that allows for fluids to be drawn or inserted into the body. Okay? So an acupuncture needle by definition is not a hypodermic. Okay? And this comes into play really critically when we look at disease transmission. Okay? A filiform needle does not have the potential of taking fluids and pathogens in and then discharging them later. A hypodermic does. A very important point. Okay. All right, needle guide tubes need to be sterile at the beginning of each patient. You're not going to use a needle guide tube on the foot and then on the face, right? Why? You guys gone to sleep again? Why would you not use a needle guide tube on the foot and then on the face? Okay, because you're bringing part of the environment from one area of the body to a very different environment on the body. Okay? If you're using a guide tube on several points on the arm, is that acceptable? Usually, unless there's some degree of pathogen or contamination that you feel would merit using a fresh tube. Okay. Are you going to use the same guide tube on more than one patient? Why? You're letting other people answer for you. Cross-contamination, right? Okay. All right, so a needle guide tube must be sterile at the beginning. If you use a needle guide tube on a patient on a clean site, and then you need to place that tube down before reusing it. Where is it reasonable to place it? On the clean field, and only on the clean field. Okay, so it is acceptable to take a guide tube that you've used on a clean area, place it on the field, retrieve it from the field, and continue using it in that area of the body. Okay, it is not acceptable to place it anywhere else. okay? Lancets and anything else that pierces the skin has to be sterile. Cupping devices don't have to be sterile, okay? But you do need to clean them according to instructions before you use them on a different part of the body or a different patient, okay? We don't have equipment or authority to sterilize cups, and in some cases that would degrade them and make them unusable, but we must clean them appropriately, okay? We're going to spend a lot of time on the clean field. Like I said, you don't have to put your alcohol swabs, which is referred to as your skin cleansing product there. You don't have to put them in the very corner of the field. This is just an approximation to show you the most serious thing is right in the center. The sterile needles stay in their packaging in the center of the field, okay? Cotton, alcohol swabs, anything else that you know you're going to use during the course of that treatment, you can place on the clean field if it is clean, okay? The sharps container, trash container, hand sanitizer do not go on the clean field. And in most cases, if that's the clean field, you're going to set your sharps container, etc., away from the field rather than right next to it, and definitely not on it, okay? Because that immediately contaminates it. All right. Used sharps. Remember the episode in the clinic where the individual placed used sharps on a tissue? Okay, no way is that appropriate protocol, right? It goes immediately into your sharps container. So if necessary, you're going to take one needle out and put it in the sharps container. Take the next needle out and put it in the sharps container. It's perfectly appropriate if you've got two needles close to each other to take one, take the second, and then put them both in the sharps container. But immediate disposal is the key. Never place them anywhere but in the sharps container. And just so you know, putting them in the trash is a violation of the law. So never take a needle and place it in your waste. It has to go in a sharps container, or you've broken the law, okay? I don't want you to be a lawbreaker, all right? You're never going to reuse or re-sterilize those needles, of course, and when the sharps container gets about 3/4 full, those needles start to do funny things like sticking up out of the container or creating little circus acts where 2 or 3 needles stand on the shoulders of other needles and stick up out of the container. So basically, once your container is about 3/4 full, it's time to get the agency that recycles your needles for you to come pick it up and replace it with a fresh one. Okay. In settings other than your office, you may be treating people in chairs or on benches. You want to be sure that they are secure if that's the case. The most acceptable way to treat a new patient, of course, until you're sure that they're comfortable with the needles, is to have them lying down on your table where they are supported and safe. If you're treating in a community setting, then you want them to be really protected if they're fully upright, or if they're sitting in a chair without support. You want to keep an eye on them or have someone else keep an eye on them as you place the needles so that you don't have needle shock or fainting in that unprotected posture, okay? But in general, you're going to want to make sure that that patient is, if you're going to needle points on the back, you're going to want to make sure that they're comfortably situated lying on their stomach. If you're going to needle front and back, you're going to find the appropriate side position for them to lie in, or you're going to position them appropriately for front and then back, or vice versa, okay? So if you have a patient having to turn while you've got needles in them, big risk of injury and big risk of patient complaint, and maybe even lawsuit of, you had me turn over and there was this needle in me and it broke or something like that. So make sure that you position them for what you want to do from the beginning, okay? And be sure that they don't become injured by falling out of the chair that you had them sitting in after you've needled them, okay? All right, we've talked quite a bit about cleaning the skin and about what clean skin looks like and about your options for cleaning. And the only time when you use gloves with an individual that you're working with is if there is any risk that you're going to be contacting their infected blood or body fluids, or if you need to protect non-intact skin on your own hand. Okay? That's really the only reason to use gloves. So if your mentor has said you need to wear gloves while you're needling, you need to quietly let the mentor think whatever they're going to think, and know that wearing gloves while needling is one of the major causes of accidents and needle sticks, accidental needle sticks. Okay? So you're going to wear gloves judiciously and appropriately. You're going to wash your hands when you take them off. And 99.9% of the time when you're needling, you're going to be using clean hands, not gloved hands. Okay? All right. We already covered this. Treatment protocols. Whether you're in your office, in the Coliseum, in a community clinic, clean needle technique applies in all of those places. There's no such thing as, oh, I don't need to clean my hands because I'm in the middle of the LA Coliseum. You still need to protect that patient from cross-contamination, right? All right. So we've had you prepare your travel kit today, not just for this test, but because preparing your travel kit according to C&T principles means that you can go anywhere having the appropriate equipment, the appropriate protocols to treat safely. Okay? So whether it's a roadside accident, whether it's, which I hope you won't have to do, and I hope you will cooperate with emergency personnel if you do in that, but whether it's that setting or whether it's a community clinic, a patient's home, you can have the confidence that your travel kit, A, is equipped with everything that you need so that you don't arrive at a patient's home without skin cleanser or hand sanitizer, and B, that you have your protocols automatic so you can spend the majority of your time focused on the patient and not on, am I doing this right? Okay? So you want your kit to be appropriate to the needs of that traveling office, which means your kit needs to be washable inside and out. And I see many of you do have good high quality plastic kits that seal tightly and that are washable, and that's a key. By the way, some of you did not receive the training course or whatever that your school would offer that would have had you prepare that kit appropriately. Can I see hands of individuals who feel their kit may not be up to snuff yet today as we've been talking about this? Like, okay, there's a couple of people who may, anybody else? Okay, not to call attention, but if anybody who has an appropriate kit would be willing to share a kit with these individuals for the purposes of the test, that way they don't have to fight with a kit that's going to get them in trouble when they walk into the test. Okay, so if you would be generous when it's time. Okay, all right, so hard-sided container, clean items packed separately to preserve their cleanliness. Sterile items packed to preserve their sterility. Separate bag for sharps container, separate bag for trash. Alcohol-based hand sanitizer readily available as soon as you open your kit. Okay. We're going to go through these protocols in great detail, so I'm going to skip over them right now because we're going to go through them, and this will be on the screen in a few minutes. And so I'm going to whip right through right now. Setting out your materials, exposing the points. We're going to come through that in a few minutes. Okay. Public health settings, like I mentioned, the Coliseum and areas like that. A little bit different standards in terms of your access to hand washing. If you're at booth 72 on the 30-yard line of the field at the Coliseum, there's not a sink there, okay? So you're going to need to wash your hands on your way to booth 32, you know, and then you're going to wash them at the end of the shift or if they become visibly dirty, right? Anywhere in between that, in a mass public health setting where you don't have access to hand washing, then you're going to use the hand sanitizer in between, okay? And you should always, whether it's at your office next to the treatment table or in your kit or in a treatment center, always have gloves available. Whether you use them or not, always make sure they are there, okay? I caught myself out in this last year. I pulled out my travel kit at a patient's home and I got all set and I realized I hadn't used my gloves in several months and they had deteriorated. Oops. You know, we always need to have those gloves available and clean. So you need to keep your kit updated. Okay. We've talked about positioning patients. In public health settings, you're going to want to, especially, in your practice as well, but in public health settings especially, you're going to want to count needles so that you know exactly how many needles you've removed from the packaging, exactly how many needles have gone into the patient, and between that patient and the next, if you have an open package of needles, you're going to dispose of the unused ones before you go to the next patient. So you might want to take a little Post-it with you. 12 needles in this patient, 3 discarded. You know, 12 needles in this patient, none discarded. Blah, 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 blah. So that at each point when you go back to take those needles out, that Post-it tells you exactly how many needles you need to retrieve to know that you're not leaving needles in that patient or in that environment that might cause problems for you later, okay? So in California, patients are not allowed to remove their own needles, to my knowledge, even in detox centers, but other places, other states, you may encounter that, and you want to train them in doing that, and then to check up after them if they do that, okay? In fainting, of course, you're going to help that patient lie down immediately. Then you're going to remove the needles. But first and foremost, if they fainted and you can't retrieve them within seconds, you're going to designate somebody to immediately call 911. Okay? 911 may or may not require sending an ambulance to you. They may require talking you through reviving that patient and finding out what happened. But it might require an ambulance. So you want them on the line anyway, so that for the patient's safety and for your longevity as a practitioner, you can say, I went through the appropriate protocol, protected the patient appropriately, 911 gave us appropriate advice, and I've documented that so that that incident doesn't become a problem for you, okay? Risk reduction has to do with paying attention to what people before you have developed to make things go smoothly, okay? So this screen kind of overwhelms people sometimes, and sometimes reading it I'm like, really? Because there's a lot of compliance. There's a lot of cooperating going on here, okay? So compliance with hazard communication status, or standard. That means anything that has biohazardous material in it has communication of its status there. Okay? That's what the standard is. Compliance with fire department regulations. As I said, the fire department does care about whether your office is safe, both for the possibility of fire and for the need to evacuate if necessary in case of a fire. And they will send examiners and inspectors regularly to your office which is quite fun, actually. All right, compliance with building and safety codes. If you already know an office has no sink, you already know that that's not an office you can practice in, okay? If there's an old medical building in which there's central access to a sink for several offices, and that is zoned medical because that access has been designed into the building, that's acceptable. But if you're going into a new space and you don't have hand washing access in that space, there's no way you can legally set up an office there. Okay? So compliance with building and safety codes, with state and federal standards regarding the practice of your medicine. Some states say that we can do injection therapy. California says we cannot. So a practitioner from Florida who moves to California can't just do injections in California because they could do them in Florida. It doesn't work that way. You have to comply with the state you're in. Okay. Documentation of accidents is one of the primary things that's going to save your self in the case of any dispute over the safety of a patient, over the resolution of an accident, etc. Believe it or not, practitioner, and I forget whether this practitioner was in Northern California or Oregon, had a patient come to their office with a companion dog, a medical companion dog, and the patient walked out of the treatment room, fell over the dog, and broke their shoulder. Okay, who would have guessed? All right, and the patient fortunately was not litigious, but in that case, the practitioner documented patient A brought companion dog B into the office. Treatment was this, care was this, patient was assisted off the table, assisted in dressing, patient left the treatment room, fell over the dog. Okay? Patient signed that, practitioner signed that, witnesses signed that. Okay? Which is the only thing between you and the law and the courts. If that patient changes their mind and says, oh, I fell over in the office for no good reason. Okay, so documenting those accidents is really essential. Okay, also safe and legal interactions with the patient. Did you know that if you take a patient's arm to prevent them from leaving the treatment room when they are highly upset, that is considered kidnapping? Yeah, or holding them hostage.
Unlawful imprisonment.
Unlawful imprisonment, thank you. That's exactly the term, okay? Did you know that placing a needle in a patient's foot when they have said, I do not want needles in my foot, is assault? It is. Okay? No amount of, this will be good for you, this will help you, this is effective for your headache, keeps it from being assault if you place a needle in a patient that does not want that needle placed. Okay? That's why informed consent is essential. Okay? So when the patient comes into your practice, you tell them all the possible things you may be doing and all the possible benefits and risks. Benefit, you're going to feel a lot better. Risk, you might get a bruise. You might have brief nerve pain, blah, 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 okay? Even that informed consent signed by the patient doesn't justify you abusing the patient by placing needles where they don't want to be placed or by doing therapy they've decided they do not want on any particular day, okay? So safe and legal interaction with your patients. Safe and legal interaction with your employees, okay? Just because you are the all-knowing, all-brilliant, all-wonderful doctor of Chinese medicine does not entitle you to yell at your employees or to belittle them or to make them feel stupid or small because they haven't understood what you, the all-powerful doctor, understands, right? So we want our workplace to be a place of protection, of safety, of harmony, actually, for everybody involved. Your patients walking out of the treatment room and seeing your receptionist cowering at the desk is not a good advertisement for what we do, all right? All right. And then completion of mandated reporting. Now, mandated reporting includes things like, did you or did you not offer your employees the opportunity for hepatitis B vaccination? Okay. Did you or did you not offer your employees blood-borne pathogen training every year on your time, not their time? Okay. So you invite them to your office on office time to do the appropriate training, and you do not penalize them for undergoing that training, right? Okay, an occupational exposure. The cleaning crew that comes in and cleans your treatment rooms has an occupational exposure. They are a hazard for needle sticks. They are a hazard for hazardous waste management and spills. Okay? The individual that works at your front desk has an occupational exposure to people who come in with contagious illnesses. So before you set up your practice, you're going to take a page and set up an understanding of who is exposed to what and what am I going to do to educate and protect them. It's very simple. But it's very important because when a health department examiner comes in, they're going to want to know. Okay? When somebody from the CDC or OSHA happens to be in the area, they're going to want to check in and see your records on this. Okay? If you're not entrepreneurial and you don't automatically think in terms of making these forms, you can buy packages online that will set all this up, and all you have to do is go through and do the activities and check them off and sign the page. Okay? So this is a really important activity. And there's details around job classifications, scheduling, methods that will all be part of that documenting. Okay, so part of our exposure compliance and protection is in things like having the appropriate hand washing, the appropriate paper towels, the appropriate gloves in the area, the sharps and hazardous waste disposals very clearly marked, having the protective equipment at hand, and making sure that not only is your housekeeping in line with what you need to do, but also that those who are involved with the housekeeping know what to do. Okay, so. All right, having appropriate biohazard signs, information and training. We've talked about vaccine, education. If one of your employees becomes ill as a result of your employment, if they contract some illness or injury as a result of working for you, you have to maintain their records. How long do you have to maintain them? 30 years. Good. Some people read the book. Yay. All right. 30 years, you have to keep those records, and they must be confidential. Just like any of your other patients, your employees have the same rights for confidential care of their health records. Okay? Similarly, as we already mentioned, you're going to document when you've given your employees training and what kind of training. Okay, we've talked about this. OSHA approved disinfectants, which is an important point, by the way. You will never win a case in a court of law by saying, I make my own lavender essential oil and I use it to clean my office. Okay, I'm sorry, even if you have documented for yourself that that's effective, it's not a legal protection. It's not a standard of practice in the field. So you want to be really aware. If you have your own lavender essential oil that you clean surfaces with, use it after you've used the appropriate approved cleaner. Okay? So, all right. Back to the diseases. Hepatitis B, HIV, blood, the most prevalent way, all right? Risk of infection. Now, remember we were talking about when the hepatitis B antigens are high, that is the surface antigens, when they're high, that is the largest risk of infection. So if you have a hypodermic needle, that is to say a needle with a lumen, and that needle has been in an individual with a high hepatitis B surface antigen count, and you come in contact with that needle and receive a needle stick from it, then the risk of developing that illness is 22 to 31%, right? So that's a hollow bore needle with a lumen, 22 to 31%. The same needle, same situation for someone with HIV, 1.8%. I mean HCV, sorry, 1.8%. So hepatitis C, a greatly lower percentage, and then like we talked about earlier, almost 100 times less risk of contracting the disease as a result of the same hypodermic, same conditions, someone with HIV. Okay, you got these down? Okay. So if you're following standard precautions, if you're using the needles appropriate to our profession, if you are protecting the patient and yourself, the risk of contracting one of these illnesses is extremely low. All right, we talked about sterilization. We've already talked about it's essential that anything that enters the body be sterile, especially when it contracts the vascular system, which basically, anytime you penetrate the skin, there's the possibility of contacting blood vessels, etc. Okay, so it has to be sterile. If you are needling in someone's mouth, as occasionally happens, or in a sensitive area where there are mucous membranes or where there's non-intact skin, then you want to make sure that everything that is used in that area, the penetrating instruments have to be sterile, but anything else should be very, very clean. So you may use a separate guide tube for areas around the genitals or areas such as the underarm. You may use a separate guide tube there to ensure the highest standard of cleanliness as we work in those sensitive areas. Okay? Now, if you're simply touching intact skin, okay, then the nature of what can touch that is anything that's clean is fine, right? If all you're doing is contacting intact, healthy skin, then clean hand, clean guide tube, clean sheets on the table, etc., is fine. Does that make sense? Okay. All right. We've already talked about cleaning spills, but essentially what you're going to do is put your gloves on, use that high-level cleanser for the spill. You're going to put that in a bag. You're going to put that in a second bag, okay? And then you're going to discard all of that material within that double bag, including the gloves that you used to clean it up, all right? And then gowns, aprons, or safety glasses where there's any risk of splashing. We've talked about gloves, except we have not mentioned using gloves. Whenever you have to put your fingers in or around a very sensitive area of the patient's skin, you may want to wear gloves, such as examining the genitals or placing your hands in the patient's mouth to examine the tissues or to place a needle. Okay. Bleeding during cupping, key here is prevent splashing and clean up appropriately. So if something is soaked with body fluids or blood, where does it go? Goes in the biohazard bag, right? Okay. If you take a cotton ball, apart from this scenario, if you take a cotton ball and close a hole where you've removed a needle, does that need to go in the biohazard bag? No. Good, you've been paying attention. All right, so you're going to stop any bleeding from bleeding during cupping with pressure with sterile gauze, right? Then you're going to handle that as hazardous waste. You're going to clean anything up that needs cleaning appropriately, as we've talked about. You're going to isolate those cups because they are a blood-borne, they are bearing a blood pathogen, right? So you're going to isolate those cups until you can appropriately clean them, all right? And then you're going to disinfect them using, in this case, the appropriate high-level disinfectant, okay? They still don't have to be sterile, but they do have to be clean. Okay, so you are today becoming a biohazard waste generator. Aren't you proud? And you need to know that basically what this means is anything that may pose a threat of infection to humans. Okay, so a threat of infection from our offices constitutes biohazard. Okay, and licensed acupuncturists, when you go to biohazard standards and studies and that sort of thing, licensed acupuncturists are right in there as generators of biohazardous waste. Yay. So you need a plan for that. Of course, you're going to discard your sharps appropriately. You're going to use the appropriate labeled bags. And as we spoke of earlier, I believe, we're going to make sure that none of that is in the hallway, in the reception area, in a patient room where a patient, a visitor, or your staff might accidentally get into it, okay? It needs to be away from general traffic and set aside until the disposal company can pick it up. So for you, a yearly physical, just because, just to know everything's good, okay? If you've had any needle sticks, you want to talk with who about what to do about it?
Infectious disease.
An infectious disease specialist, who will then also guide you if you need any rechecks at any later dates. Okay, you're going to protect yourself according to what we've spoken of. The American Hospital Association says if you're sick, you be aware of whether you should be treating patients or not. If you're infectious in any way, you need to have medical advice on whether it's appropriate to be treating patients on that day or in that period of time. Let's say for whatever reason you were exposed to hepatitis B. Remember, how long can you be contagious after the disease is resolved? Up to 3 months, right? You've recovered, you're no longer in the disease state, but you can still infect others as you're shedding the residual virus for up to 3 months, right? Okay. So if you have an illness or injury that affects your ability to practice, your state board has advice for you on that. They have an advisory board that can meet with you and can tell you the limits to which you can practice until your condition is resolved. Okay? And you want to take that very seriously because otherwise you could be at risk for a lawsuit for putting the public at risk. So annual testing through TB. We haven't really spoken about TB, but if you treat a population that has TB or if you treat a population from countries that have tuberculosis, it's a good thing to keep an eye on your own exposures and to be tested. You do not have to be tested for HIV, but it's recommended if you work with that population periodically. And of course you want to be tested after a possible exposure. Okay? And again, your expert review panel plays a key role there. Okay? Maintaining records, if you are going to step into the mantle of being a physician, which in the state of California you are, then you have an obligation to maintain thorough, professional, accurate records. Okay? This means black ink, which is still the legal standard. This means legible handwriting. This means documenting your findings, documenting the care given. So not just acupuncture treatment, 20 minutes, but treatment with gallbladder 20, Ding Chuan, LI4, liver 3. Okay? So every patient record needs to be thorough, clear, and complete. And that's the only defense you have if a patient comes back to you 5 years later and says, oh, this doctor gave me nerve damage because they put a needle here. If you've charted and documented all the way through, then any examiner can find, oh, you never put a needle in that elbow. There's no problem here. Okay, but if you didn't make those documents, good luck. Patient confidentiality, you can buy whole kits and online training about this. That's all I'm going to say. The patient, their records belong to them. Be aware of the HIPAA Act and of everything that it means for your practice. You cannot discuss your patient's well-being or their diagnosis or treatment with anybody else unless the patient has authorized you to do that. Okay? So can a husband keep his medical condition from his wife? Of course he can. Is that wise? We don't know, depending on the condition. But we do not have the authority to reveal someone else's medical information to anybody else. Okay? Informed consent, if it's not dated and signed, it becomes a case of he said, she said. You know, I told them that I was going to put a needle in them. They said it was okay. But if it's not written down and signed, it won't necessarily stand in court. Okay. We've talked about testing following accidents. Talked about prophylaxis to a certain degree, although antiretroviral medication for HIV needs to be started within hours, which is one reason you really want to educate your patients about lifestyle if they are prone to risk. HBV, again, 1 to 7 days after exposure, not 1 to 7 days after the disease has been diagnosed, right? 1 to 7 days after exposure. And there is no treatment for hepatitis C exposure. Okay. This one you've memorized, right? Seroconversion, which is to say that the disease developing fully in the blood, converting to a disease state, following an accidental needle stick with a hypodermic needle, with known positive blood sample, HIV. 0.3%, HBV, hepatitis B virus, 22 to 31%, hepatitis C. Okay, all right. All right, with pain on insertion, you guys have all been taught this, but basically you're going to evaluate what caused that pain, and then you're going to antidote it. Okay, so if the insertion was too strong or near a structure that has gotten injured in the process, you're going to exert pressure in the area or gently unwind the needle or stop doing the extremely strong technique. If it's alcohol that hasn't dried, don't do that to your patients. Let that alcohol dry, okay? When you are letting that alcohol dry, is it appropriate to fan it to help it dry faster?
No.
Why? You're driving pathogens to the area for a little bath, right? Okay. Fainting. We've talked about this. Make sure that the patients don't come in too fearful, too hungry, too exhausted. Make sure that they are in a secure position. And if they faint and you can't help them regain consciousness immediately and in a very clear and understandable way, then you need to call 911 for guidance. Using DO 26 or pericardium 6 to revive the individual, using acupressure or moxa. And once they've revived, you can use stomach 36 if you needle the upper body to help restore basic balance, or LI4 if you needle the lower half. Okay. A stuck needle, you should know before you ever get into clinic how to remove that, including tapping, puncturing nearby, turning it in the opposite direction. There's lots of causes for broken needles, but what's the key thing you can do to prevent a 911 call if there's a broken needle? You don't insert it all the way up to the handle, right? If it's inserted all the way up to the handle and the needle breaks, then you have to call 911. But if the needle is still, if the shaft of the needle is still graspable above the surface of the skin, then you're okay, right? Okay, pneumothorax, one of the major contributors to lawsuits. I hope you read your book on this. We're not going to go through it in great detail, but whenever the patient starts coughing, turns pale, or even loses consciousness, when you've needled any area where the lungs might be close to the surface, you know that you may need to immediately give them a ride to the emergency room via an ambulance in order for them to receive appropriate care. At the very least, you're going to call 911. You're going to know your organs, placement, know your spinal cord, know better than to cause injury in those areas. 1 minute of pressure if you've accidentally injured vein in the process of needling, or up to 5 minutes if you have caused an injury in the area of an artery. Okay. Direct pressure. Electrostim, not with pacemakers or electrical appliances anywhere in their body. You already know this. Don't do it for people who have seizures. Don't cross the mid-sagittal line. Don't cross front to back. Don't cross the heart side to side. Use the proper needles. Doing electrostim through plastic handled needles will not result in any benefit at all. Okay? The electricity won't transmit. So use the proper needle, the proper size, so that the needle stays instead of falling right out, etc. I am always astonished to realize that this is currently the most common malpractice claim, moxa. Okay? So at the very least, keep your hands between the moxa and the patient so that you can tell if you're getting burned. If you're getting burned, it's a sure sign they are getting burned, okay? But no appropriate care for the different kinds of moxa and no appropriate cautions to protect against burns. If it's a very minor burn, you can treat in the office. If it's not, you have got to refer them for medical care. Okay? All right, your state board, wherever you are, trumps this course. If they have any requirements that go above and beyond this course, they win. Okay? And for example, this last, we've talked about different levels of skin cleanliness, but there are some states that say, I don't care if it's clean or not, you've got to use an antiseptic. Other states like California and others are accepting of washing, etc. instead. All right, so any questions? I'm only a half hour late. Our examiners have arrived. Any questions before we take a 15-minute break? Anything that you saved up for today? Nope. Nope. Thank you for your tremendous cooperation. I really appreciate it. And again, from here on out, there will be no use of any electronic devices. Okay, so from this point on, if I see you using an electronic device, or if any of my team see you using an electronic device, I get to have it. Okay, I get to keep it until the end of the day. All right. Now, if you have childcare issues, or if you need to give somebody notice to come pick you up 2 hours before, they're going to get here, come to us with your phone and let us give you the opportunity to make that phone call securely, so that you know and the rest of us know that the exam is not being compromised. Okay? All right. Thank you. So 15-minute break. So that'll bring us back at 1:15.